All right, so we're going to go ahead and get started. Everyone, welcome to this community conversation focused on economic justice. My name is Kiara Benez, and I am the nonprofit specialist at the Catalog for Philanthropy. I'm very excited to be here with you all virtually and for this conversation we are about to have. This evening we have two great panelists who I will let introduce themselves in just a moment. This is a quick conversation, so I want to make sure that we dive right in. We will have some time at the end for a couple of questions. So if you do have a question that comes up during the conversation, go ahead and drop it in the chat, and then I'll make sure that I bring it up verbally to our panelists. So with that, we're going to go ahead and get started. And we'll start with you, Laura. Can you tell us who you are, what organization you're with, and a little bit about what you do?
Sure. My name is Laura Brown. I'm the Executive Director of First Shift Justice Project, and we are an organization that's based in DC that provides legal assistance and advocacy to working mothers and other caregivers. The issues that we focus on are related to leave for medical reasons and to take care of family members. We help women who are and other birthing parents who are pregnant get accommodations on the job. We've been very involved in the DC Paid Family Leave movement. And we provide technical assistance to medical providers who are providing the medical certifications for people to get the leave they seek, as well as the accommodations. We also have some involvement in helping people get accommodations for lactation when they return to work after giving birth.
Fantastic. Thank you so much for sharing that. Evelyn, can you tell us who you are, organization you're with, and a little bit about what you do?
Yes, good afternoon, everyone. Evelyn Urrutia, Executive Director of Changemakers United. We are a Northern Virginia-based organizations. We're really focusing in three areas in Northern Virginia: Alexandria City, Fairfax, and also part of Prince William, which is most like Woodbridge and Bell City. We're really focusing on social justice issues. Our organization is really focusing on deep organizing, leadership development, and trying to bring the voice of the most impacted community into the decision-making process. We're focusing in four areas at this moment. One is access to housing, more like looking at the housing situation that we have, that there is not affordable housing, there are not policies that really support our community in the ground to ensure that they have a dignity home. At this moment, education justice, immigrants' rights, and also we're focusing on health access. But it's more on the lens of trying to get the government and private and identities, organizations, foundations really focusing more on the most needed and impacted community, especially now with COVID. Part of our work is the direct support also that we provide to the community. And this work was expanded in our organization due to the pandemic on 2020.
Great, thank you, and welcome. We'll go ahead and jump right into our first question. So I'll start off with, many frontline and service industry workers have experienced a lot of shifts in their job expectations, pay, et cetera. What are some of the top concerns right now that you are both hearing from the workers that you organize with?
Well, I can start, and I can give the perspective of the clients that I work with, and they're just trying to stay employed. Parents are not okay. And we're providing virtual learning for their children during the pandemic. And in the fall, we've seen, kids going back to be in public schools. But, I'm a parent myself. We are doing temperature checks every morning. We are doing symptom screenings. If our kids are exhibiting any kind of symptoms like sniffles or a cough, they can't be sent to school. And there are not corresponding protections for parents who are trying to go back to work, but who wake up one morning and have a kid who can't go to school, or have a kid who's getting sent home because they've been potentially exposed to COVID and have to take time off. And then the parents told, well, you can't come back until you have a negative COVID test. And then you research and find out, well, how do I get a COVID test for my kid? Well, you can pay for one, and get really quick results, or you can have your kid take a test and maybe you'll have results in 3 to 5 days. And so that is 3 to 5 days that if you were on the work schedule, you now have to call your boss. And there is no jurisdiction that provides enough paid leave to accommodate those circumstances. And so what we're seeing is parents who very much want to return to work, but who are just not, paid family leave was a problem before the pandemic, but it's an even more difficult issue to deal with now. And then the other issue we're seeing is just fear. People who are going back to work, but are afraid of being exposed to COVID. People who have just given, we deal with a lot of pregnant workers, people who are have just given birth recently and have babies at home who they are now worried that they're exposing to COVID potentially. Because a lot of people are working in the service industry and they have direct contact with many different people all day long. And so there are a lot of challenges related to that.
Absolutely.
Yeah. For us, it's a little bit similar, same conditions. But what we see is that our people is definitely going back to work. A lot of our families, they don't have the luxury to stay home. They're undocumented immigrants. So they're going back to work. But we have few issues of families that they do want to go back to work, especially those families that the wife and husband were working before the pandemic, and now they have to make a choice on who's going to stay home if the kids get sick or the kids get sent home from school. So we have few issues around that, but one of the things that we have noticed is that our people have not stopped working. Only if they had got sick from the pandemic, they start working a couple months, a couple weeks, but a lot of them, they're back up there already. A lot of the families that we work with, they work in construction, cleaning industry. A lot of them also in the restaurant industry and the service side. And that's the ones that they take a little bit more time off of work, but construction workers have not stopped. The cleaning company have not stopped. So we still have a lot of families working. So I think our families are ready to work and they're working, but they do face some challenges, especially with childcare.
Great. Thank you for sharing that. As you both are mentioning, there are a couple different angles and different things to fix in this overall system. I'm curious to hear what a couple of your top advocacy goals are right now heading into 2022.
I think for us, it's more around housing, security. We see a lot of before pandemic in the Northern Virginia, we were already struggling with affordable housing. A lot of the families that we work with, they're low wage pagers. They don't make enough money to really live in the Northern Virginia. And with the lack of affordable housing is something that is critical for our families. The other issue that we're facing a lot is access to healthcare. Right, we have access to the vaccine, access to testing, but there isn't a lot of the families that we work with are undocumented, not health insurance. So, and there is side effects, and a lot of them have been sick from COVID, and they are having side effects. So, how we're going to deal with that is a big issue, at least in the communities that we work with. So, I think that's the two issues that definitely we are paying attention. We definitely working and trying to get that not just only city council, but also, like I said, that Department of Housing to really look at this matter and see what it can be done. I think this is an opportunity to improve the policies that are in place to ensure that there is more affordable housing, but also access to the housing for families that we work with.
On our end, we're spending a lot of time advocating for people to have more access to leave. The paid family leave program in DC launched right in the middle of the pandemic, and immediately, advocates predicted this because we were very involved in the passage of the regulations and things like that. But so it was no surprise that we were immediately aware of obstacles to people being able to actually access that leave. And so those benefits, so it sounds really good that DC has paid family leave benefits, but the people who are accessing them are the people who already had some leave. And the people who didn't have access to leave benefits like pay still don't have that access. And so in October, we were able to successfully advocate for some changes, technical changes to the program that will allow more people, we're hopeful, to access the leave and the benefits. The second thing is that, everybody's kind of itching for, somebody to declare that everything's over with the pandemic. We're all back to normal. It's all fine. And so we have to keep going back to the council to have them extend some of the protections that workers have for the pandemic. And, an example is that, you were able to take paid, unpaid, but job protected leave for some reasons that were related to COVID. And that was supposed to end November 5th. We got that extended. And then we also were able to work with the Labor Committee to get legislation passed that provides paid leave for people who are seeking vaccinations. And so parents, both individuals themselves, but significantly now with the vaccination being available for elementary school aged kids, that parents will be able to take paid leave provided by their employer, both to take their kids to get vaccinated, but then also if their kids experience side effects, to take the day off the following day if they are recovering from the vaccine. And so those two things were really significant. And the other thing is, before the pandemic, we were working with the National Domestic Workers Alliance to get a domestic workers Bill of Rights in DC. And that has only been exacerbated. The need for that has only been exacerbated by the pandemic. When the mayor came out with orders related to workplaces and safety, domestic workers who work in households and who are some of the most vulnerable workers to the virus because of the circumstances in which they work, were not even, they were not even addressed. They were absent from any conversations about, and so we found ourselves trying to figure out how the mayor's order would apply in a private household, which was nearly impossible. And so safety is something that's included in our Domestic Worker Bill of Rights, and then also protection from discrimination. Because when people were starting to be rehired in domestic work, you can imagine, as was the case also in a lot of other workspaces, that people who were old, people who were viewed as more vulnerable to getting COVID because of their race or ethnicity, those people were very vulnerable to employment discrimination. And right now, under our DC Human Rights Act, domestic workers are the only group of workers that is excluded from any kind of employment discrimination protection. And so those are, that is a very high priority for our organization, because that's our target population, is women who are in low-wage jobs.
Definitely. And thanks for sharing that. And something you mentioned really stuck out of, this is not, we're trying to figure out what this new normal kind of post-pandemic, what are the lasting effects there? So kind of building off of that, many people are commenting on the Great Resignation and why workers aren't taking available jobs. Based on different things that you both have said over the course of this conversation, it's obviously much more nuanced than that simple narrative of the Great Resignation. Can you both give us some insight on your perspective regarding that topic?
I think we don't see that a lot with our community. Our community don't have no choice. Our community that we work with are the people who were working in the middle of the pandemic, at the beginning of the pandemic. They still up there. They don't have the luxury to really say, I'm not going to go to work. In Virginia, there are not many protections around that. So, if you don't show up to work, you will lose your job. So we're looking at a state that is not really for the working class, people of color, immigrants. That is not, there are not many policies that really protect our workers. So we see that a lot probably on people who earn a little bit more, that have the luxury to say, I save enough, or I can qualify for unemployment, or I can, qualify for other programs. But a lot of the families that we work with, they don't have that choice. They don't have the luxury to really say, I can stay home. So, we are there at this moment as an organization, really trying to struggle and with our community and trying to ensure that they're getting the health access that they need at this moment, to ensure that they get any support that is available that they can get in order for them to continue working, because they have not stopped.
Certainly.
And for my part, I'll say that, just as Evelyn was talking about, I mean, for our clients, work has always been very difficult. It has always been, involved a lack of any kind of schedule flexibility, unsafe working conditions, disrespectful treatment, and even in DC, where we have all these protective worker-friendly laws, difficult in enforcing those laws, and employers who just openly and blatantly ignore those laws. And so, I mean, I referred to earlier, when you talk about a great resignation, like I kind of bristle at that term that has taken the life of its own. Because, I receive calls from workers like Evelyn does that are working and trying to stay working, and then not able to continue working because they don't have any flexibility. Their employers are completely inflexible and don't, follow the laws, and, for all these reasons. And so then the employee isn't able to continue working. And so is that a great resignation? I wouldn't call that a great resignation. I call that a constructive discharge as a lawyer. So, is that a resignation? Is it not? The second thing is that just because we all got a bunch of shots in our arms didn't alleviate all of the effects of the pandemic for these workers, which is that they were suffering from, increased levels of domestic violence. They were, parents were home virtual learning, with their kids for a year. And, some of them are facing or at risk of eviction. And a lot of them have ill family members. They're grieving from dead family members because of the pandemic. And so not all of those situations resolve, just because everybody says in the, kind of in the public sphere, it's time to return to work. And so there's a lot of things that, prevent people from being able to be present to work and to return to work. And so, and so you've seen lots of workers organizing around the country and saying, we need things like paid family leave. We need, we can't do this. And to be honest, I also think that, the workplace can be such a toxic environment and so stressful. And we've seen it in terms of like health conditions for the pregnant women that we work with, and others, that blood pressure goes up because of work situations that are stressful and all these things. And so then a lot of these people were laid off, and they spent the last year at home. And while other things may have replaced those stressful situations, some people experienced relief from that toxic stress. And so the idea of going back under even more difficult circumstances, I honestly can't blame people who don't want to go back to work under the conditions they were working in. So we aren't seeing those people. We're seeing people who want to go back to work. But theoretically speaking, based on what I know about the workplace, I can't say that I blame them.
Definitely. And what I'm hearing from both of you, or at least summarizing all of this in saying that, the Great Resignation may be happening for these kind of underlying issues that the pandemic really exacerbated and surfaced that were kind of already happening. And for the populations you both work with, the groups need to continue working, and it's something that needs to continue on there. I do want to be conscious of time, so I'm going to ask one more question, and then from the audience, anyone who is joining this community conversation this evening, if you do have a question, feel free to put it in the chat and we can try to get to that. But kind of final question from me, if somebody wanted to get involved with organizing or advocacy, what are some first steps that you would recommend, and kind of what volunteer roles often exist in this space?
For us, it would be if they want to volunteer at least 2 hours a week, get to know the communities that we're working on, and get familiar with the community, right? Because you have to earn the trust in the community. So a couple hours a week, it can be good to start. And I think we take the rest, which means we can definitely dedicate the time to work with them and develop them in some way, right? Because we do that all the time with our community. So we're more than happy to also do that with our volunteers. If they really want to do organizing, but also there are some other roles in our organization, right? We do a lot of homework help and access to services, right? So if they're not feeling comfortable in doing organizing and learning more about how we do the leadership development and get connected with the community, we can definitely find other areas in our organization that they can dedicate some time on it, whether it's providing service, providing mentorship to our youth, anything around the lines. We will be more than welcome to get people and work with them.
And honestly, as far as getting involved with First Shift's work, we need domestic worker employers to step up and support this domestic worker Bill of Rights in DC. We are, work with a group called Hand in Hand, which is a domestic employers organization that works with the Domestic Workers Alliance. And, the domestic workers haven't really had a strong presence in DC until this campaign. And similarly, their Hand in Hand program, they're really eager to have domestic worker employers who believe that the workplace should be a more just and fair place for domestic workers to step up and support the law that we're trying to get passed. So if anyone would like to do that, I would love to receive an email from you, and I will immediately connect you with the organizer from Hand in Hand.
You heard it here, folks. Well, we are just about out of time, but I did want to thank both of you for such a great conversation, such important information, and from an incredibly unique and vital perspective in this community. Thank you all in the audience for joining us and your engagement. We are going to now head over to the main stage to hear some quick advice on how to get more engaged locally with issues just as this, and as is the other community conversations that just happened. And we'll also share some thoughts and reflections on this evening. So this time I'm going to invite you all over to the main stage. So if you're on your screen and you're looking at it, it's on the left-hand side of the screen. There's a button that says main stage with the video camera. Thank you again, both Evelyn and Laura, for joining me in this conversation. And I will see you all back over at the main stage.